ahead and get started. Welcome to today's presentation on Updox for Practice Fusion, where we'll discuss making more room for patient care thanks to our integration. My name is Katie Lashley, and I'm the Director of Sales here at Updox, and I'll be taking you through the presentation. You've probably noticed that the phone lines have been muted. We are recording the presentation, and we'll be sending that recording to all registrants after the event. I will take questions at the end. If you go ahead and use the question section on your GoToWebinar panel, you can click the triangle or the plus sign to open, type your questions in there, and I'll get through as many as I can here at the end. So just to get started here, Updox and Practice Fusion, we've actually been working with Practice Fusion customers in a non-integrated capacity for years. And then we went ahead and made it official with a seamless fax integration in addition to our direct secure email back in 2015. And what we've been able to learn in that time about Practice Fusion providers is that while you're constantly trying to improve the care you provide in today's climate, you're also trying to cut costs wherever possible in an effort to remain independent. Providers have never seen more patients on a daily basis. You've never had a more complex tracking requirement as far as encounter notes and ICD-10 and all that good stuff. And in general, you just need a break from the harder workflows that you've had to implement in your practice. And what Updox has been able to do is simplify some of those workflows for Practice Fusion users, getting rid of some of the more repetitive and clunky workflows. Thinking through kind of the evolution of technology in the workplace in general, industries not regulated by HIPAA have had the advantage of fast-tracking communication with things like email and instant messaging. What Updox has been able to do is bring that same fast-track communication tool to medical practices, bringing them into the 21st century in a HIPAA-compliant way, and one that ties seamlessly to the EMR you're using all day, every day. So in your world, you can't send a quick email with PHI to get a quick response and file it into the chart, so you're still faxing. And what that looks like, and I wanted to go through just kind of step by step here, is how much work goes into the over and over again workflow of managing faxes in a paper fashion. So initially you're sifting through a pile of paper on your fax machine, distributing it for signatures and notes. You walk it back to the fax machine to push it through, wait for that transmission report, because if it doesn't go through, you have to send it again. And then you scan it into the computer when it's all said and done with the transmission report. From that point, it's still not in the chart, so you're going to have to log into Practice Fusion, find your patient, go to patient documents, and select upload, all to get that document into the chart from a paper perspective. Maybe your practice has moved to a fax server in some of the years where we weren't integrated with Practice Fusion. We do speak with a lot of Practice Fusion users who have picked up another piece of hardware. Sometimes they're HIPAA compliant, sometimes they're not. But the reality is there's still a lot of steps there too. As the only integrated fax partner for Practice Fusion, your fax server steps for a non-integrated solution would include opening whatever application or hardware you're using on the desktop, viewing your fax. Oftentimes these hardware solutions don't have the ability to do an e-signature, so you end up printing it to paper to jot a note down, or even from an annotation perspective, maybe you needed to write a quick note. You don't have an editor or an e-signature, so you end up printing it to paper, whereas Updox offers the ability to sign and annotate electronically right from within the app. If you have more than one patient included in one fax, or maybe a document that needs to be split up to a few different chart sections, we've heard too that you still end up printing those out because you can't split them up easily with a hardware solution. From there, you're going to go ahead and save the fax to your desktop, which is questionably secure in terms of HIPAA, because it is considered data at rest and it would not be encrypted at that point. You're going to log into Practice Fusion, again, find your patient, go to patient documents, and select upload. So you still have the same back end of steps that you would with a paper process, with a hardware process, with an added question mark in terms of HIPAA compliance. So it's as easy as those 10 steps, 100 times per day, unless of course they misplace your fax or they tell you they never received it to begin with, and then you get to do it all over again, and maybe your office staff looks a little bit more like this. So just hitting on kind of the redundancy and the reality of a paper-based or a non-integrated solution for faxing. With Updox, we can take care of that for you in just a few quick steps. Updox is a web-based application accessible anywhere with an internet connection, and your login credentials are the exact same as the ones you would use for Practice Fusion, so you don't have to remember a new username and password, which I know can be a pain in the world we're living in. So you log into Updox, you review your fax, you can split it apart page by page if you need to, you can open it up and edit or sign electronically, and then you can go ahead and send it. And what's really slick about our sending screen is that not only are you able to send it to the patient's chart, but you're also able to send it out as a fax from that same screen. And because you're doing it from the same screen, you can do both at the same time. So if you had something come in that you needed to fax back out, but you wanted to track that you had done so by putting it into the patient's chart, instead of pushing it through the fax machine, grabbing that page in their transmission report, scanning it into the computer, you can actually fax and file at the same time, and those audit trails will take care of you there. So Updox would be solving a huge pain in your office, but we do understand that there can be some concerns when adopting a new technology partner. We're used to that with over 38,000 providers in the Updox community. We've gotten to know our practices pretty well, and some of the common concerns we hear when providers and office managers are evaluating a new technology partner are time and cost. So from a time perspective, you're on the hook to stay up to date with ICD-10, meaningful use stages 1, 2, and 3. Maybe you're looking into MACRA and MIPS for next year. Most practices are comprised of workers dedicated to providing care to patients as well. So you also have varying comfort levels and passions for technology. So you're worried about the time it would take to learn a new solution. From a budget perspective, you don't have excess budget to spend on new services. You don't have an added item that you're able to add to your budget. So you can't afford an additional cost. You're concerned because you fax a lot. These are the things that we hear on a day-to-day basis, which is great because we've built our solutions with those concerns in mind. So I'll show you a little bit about the application itself so you can kind of get a feel for the ease of use we've built in and the time savings that we would allow. And then we'll talk about hard costs a bit later as well, because one thing that is important to note with Updox is that we're not going to be an additional cost for your practice. We will replace something that's probably costing more than you think it is. And then there's also time savings in there too. So we'll touch on that a bit later, but let's take a look at what the actual application looks like. So what we're looking at here is the main section where you enter Updox. Again, it's a web-based application accessible anywhere with an internet connection, even from your phone, and it's basically an inbox for your fax. You might notice that it looks a lot like email, which was intentionally designed to look a lot like email to keep it as user-friendly and as short of a learning curve as possible. And what you can see here are your faxes coming in. So at the top of your inbox, you'll have your newest items. Each item has its own full horizontal bar, and then you'll see little thumbnail previews for each page in the fax as well. So giving you a really easy way to review those faxes. You can either mouse over the thumbnail preview to kind of see what the fax is and determine your next steps. You can pick and choose your pages using the checkboxes. So when we had spoken about being able to omit a cover sheet or split things into 2 documents, those are the checkboxes that you'd use to do so. And then when you're ready, you can go ahead and hit send and then file it to the chart or fax back out or do both, whatever the case may be. But in the instance that you needed to edit that document before you send it to the chart, it's as easy as just clicking on one of those thumbnail previews, and it'll open our full-scale editor, which allows you to do things like type in notes or numerical values. So if you needed to approve something or fill out a form, you have those tools handy. You also have checkboxes for forms and refills and such. You have a freehand drawing tool. You have an eraser. You have a highlighter. And probably the aha moment for most providers is that you have the ability to do a one-click signature. So you can store one signature per username so that when you open up this document on the go, you can click once to sign it, time and date stamp it, and be on your way. So really, really slick, easy to use editor there. Now, a key piece of our integration with Practice Fusion is the ability to file documents directly into the patient's chart within Practice Fusion. The labels here probably look familiar, as they're the exact same fields you'd use when importing a document into Practice Fusion using their upload feature. So you can title the document, You can choose the document type from the same list that you're going to see in Practice Fusion. You can assign the document to a provider as a task, so you can kind of create tasks while you're filing to the chart. Or if you are the provider, you can even sign off on it while filing. So depending how big your practice is, if you have providers managing faxes and filing to the chart, you could save the step of having to sign off on it later by just signing off here. Now, if you have other users who are managing the incoming faxes and putting them into the chart for you, they can create the task. So whether you're a provider that wants to get involved in Updox and the front end of faxing, or if you want to just hang out in Practice Fusion and have the documents come to you a little bit easier for your staff, both of those workflows are accommodated. Another nice feature of our sending screen are the little thumbnail previews actually follow you down at the bottom. So those same thumbnails that you were able to mouse over in the inbox, you can mouse over in the sending screen. So think through faxing or filing 100 documents per day. Maybe you forget the number you're faxing to, maybe you forget the date on the lab order that you're sending, or the patient's date of birth. You can mouse over those to just remind yourself. So again, really trying to think through the big things and the little things that might bother you on a daily basis, make it as easy as possible. We do use this same sending screen both for faxing and filing so that you can accomplish both at the same time. So if I wanted to also fax this out, it'd be as easy as typing in the fax number in that top right field there, typing in the number, and then a little fax sheet comes up for me. So again, I can include a subject, I can choose to send a cover sheet, get into that too. So I can do a subject here. You have the ability to create multiple fax cover sheets. So if you wanted to have one for certain types of documents, or if you have multiple locations and you wanted a fax cover sheet for each location, those are kind of some workflows there. And you can create those kind of on a large scale. And then what you're also able to do is, let's say you have a quick note that you need to jot down before you send out one specific fax. Let's say you have a quick note you jot down a couple times per day. We have the ability to either add a quick note manually, or you can even create templates for those quick notes. So if you wanted a template that said, please contact the office with questions, or if you wanted a signature specific to a person in your practice so that they knew who to contact about specific things, that would be a good time saver to use those templates in that section. So what happens if a fax fails? We've heard this happens from time to time. Updox tries to a few times to send a fax. I think it's 4 or 5 times per industry standard best practices for faxing. But the reasons that you might get a fax failure would be maybe a busy signal because they're faxing out a big document and they're still using a dial-up fax. By the way, you would eliminate that problem with Updox because we're server-based faxing and you're going in and out on our lines. Or if their fax machine was offline because their paper fax machine is acting up, if you have a wrong number, all those sorts of things that would trigger a fax failure, we actually proactively notify you when it happens. So you're not going to be sitting in Updox waiting to see that the fax went through successfully, wondering if you need to resend it again. You can actually continue on with your day and your normal workflow, and if something does go wrong, we'll give you a fax failed notification right at the top of your inbox. You're also going to have a full audit trail in your sent box. So that's going to include anything that you're faxing out, whether it was successful or unsuccessful, which is important because even though we successfully fax someone on Wednesday, that doesn't mean that they're not going to ask you to refax it on Thursday. So rather than having to go back and redo all of the steps to pull the fax, it's as easy as hopping into the sent folder, typing in the number that you sent it to, and we'll pull up all the faxes that you sent to that number, and with a few quick clicks, you can actually send it again. You can also see who had sent the fax specifically in your practice, and also chart imports are going to be in here. So if you wanted to see who was doing your chart imports, you'd be able to look in here and find that too. So a really nice comprehensive audit trail. Now, in addition to faxing, we've also been able to add a kind of a patient engagement and contact engagement tool called Updox Blast. So I wanted to show you around that a little bit. Thinking through what you were doing for Blast kind of before Updox was around, probably a provider or an office manager asking you to call a certain amount of people and let them know things. Maybe you have postcards, maybe you have, you're sending portal messages, something like that. So what on-demand messaging from Updox has been able to do is allow you to send messages to groups of people en masse. So when would you use it? This time of year, you might use it for office closures. We have a lot of practices who are grabbing no-shows and sending them a message to get them back on the calendar. Flu clinics, immunizations. I know we're getting a little bit late in the season for that, but that's another popular use. People who are due for annual screenings. And then one way that practices are using this that we kind of have been surprised about the popularity of is sending birthday greetings to patients. So kind of a warm birthday message that you're able to send. And then we've even had providers that are sending a birthday greeting and tying it to a survey link. So if they're trying to up their reputation management online, they're able to send out a blast birthday greeting and say something like, happy birthday, if you're happy with us, go here to review us, that sort of a thing. We also have practices who use it to maintain contact with their actual contact Rolodex, because it's not just for patients. If you wanted to get a message out to all of your referral sources, if you wanted to get a message out to all of your staff, we could do phone, text, and email messages for that as well. And what it is specifically is on-demand messaging by phone, text, or email. You can target your messages to a specific group. You can deliver them in a fast, convenient, user-friendly manner, and it saves obviously the time and money over individual calling, emailing, or texting. Super easy to use, as Updox solutions always are. You would essentially just select the method of message that you wanted to do. Grab a patient list, which Practice Fusion makes it really easy to segment out your patient lists to import into Updox. And then we have a little uploader tool that you get it in there. And then you select your list and your medium, and then you can go ahead and just hit the send button. If it's something that you're kind of doing on the fly and it's just a one-time message, that's probably the quickest way to get it out. We also, knowing that you might want to send that birthday message over and over again, have created the concept of templates within Blast. So if you are sending something like every week you want to send a message to your birthday people, you could go ahead and create a template for that so that you're not rekeying that message over and over again. Templates can use the first name, the practice name, and the phone number so that you don't have to write those in. You can kind of auto grab those variables, and they can be saved and reused kind of as we go along. In terms of creating those templates, super easy, and we allow you to preview it. So you would go ahead and create the template, type it your message, type in your phone number, and you can hit the preview button and see exactly how it's going to sound. Text messages, just as easy to do, and the preview in this situation is going to show you on an iPhone right inside of the screen, so you can kind of see if it looks too long, if it looks too spammy, that sort of thing. You can also do custom list builds. So once you've imported your list into Updox from Practice Fusion, if you wanted to pick and choose which patients receive the message or contact, so if you have one that you know if you start sending them messages, they're going to be on the phone calling you and it's not worth the effort of getting that out the door, you can actually remove them from the list, kind of picking and choosing. Or if you wanted to send a cancellation message to all of the patients on your schedule today, and you also wanted to include a few staff members, you can add people to a custom list as well. We do also offer comprehensive reporting for Blast, which is going to provide summary and detail level views into your outreach. You can filter by date range, and the dashboard is going to show the summary of the messages sent, how many were delivered, and how many failed. You're also able to drill down and look at the reasons why specific messages or recipients were successful or unsuccessful. So if you were looking to clean out your data and find out who you don't have mobile telephone numbers for instance, this would be a really slick way to do that. So that's kind of an overview of our two big solutions that we're going to talk about today, which would be the fax and the Blast messaging. Now we do have some ROI kind of information that I wanted to go over with you, just in case we have some numbers people on the line. Sometimes these problems and these steps and the drain on that feels more severe because you're the one kind of going through the motions. So I wanted to make sure we included a little bit of information on the ROI, just in case you're looking at Updox strictly from a budget and an ROI perspective. So we've been able to pull following stats from our customer base for how much they're spending per 5,000 pages. So if you consider $72 in toner from a Brother fax machine, toner's a big one that people don't think about, and it's super expensive, part of the paper fax process. $50 for a case of paper and $40 for a fax line. That would be $162 for every 5,000 pages is what practices are spending from a hard costs perspective. And then from a time perspective, and you think about how much you're paying kind of your support staff, if it takes just 2 minutes per fax, which I think is pretty reasonable with the steps, it would be up to 55 hours to work through those 5,000 pages. Now, from a time perspective, we like to say that we cut the time spent on fax at least in half, if not more than that. So trimming that down to about 25 hours. And then from a cost perspective, to fax the very same 5,000 pages for a practice on a monthly basis, we're able to save practices more than $30 per month. So from an annual level, that would mean that we're putting another $360 back into your budget. Coincidentally, our blast solution is actually priced right around that number as well. So if you did want to go ahead and add that in, you wouldn't be adding spend to your budget line. You'd be reallocating what you're already spending to use a more efficient solution and kind of engage your patients and contacts a little bit further. Now, it is a new year, and we are ready to partner up with your practice to help you save time and money in 2017. And because we appreciate you taking the time to look into Updox today, we do have a special offer. We're so confident in the value of our solution that not only do we offer our service without a contract, so it's month to month. You can cancel anytime if you determine it's not a fit for you. But we also let everyone try it for free for 15 days. So a no-risk trial where you can see if it's going to be a fit for your practice and walk away without a cost if you determine it's not. If you get started with that trial by Monday, January 16th, we're also able to offer the promo code RESOLUTION, which will get you a 10% discount on your base fee for the full year of 2017. So really great promotion to get you started. I think it's at least $70, $75 in savings if you look at it across the year. So definitely a great time to get started. Now I am going to go ahead and pause for questions. Again, if you type in submit your questions in the question section on your GoToWebinar panel, see what I can do. A question about faxing prescriptions to a pharmacy. So you're able to fax up to, in and out of Updox all of the same ways that you would a paper or a server-based fax. That being said, we are not an e-prescribing solution. So if you were looking for e-prescribing, you'd probably need another module from Practice Fusion. But for faxing in and out with pharmacies, you could use Updox for that. A question about the recording. We did record today's presentation, and we'll be sending that out to all registrants after the event. A question about cost per user. Our pricing model is per provider pricing with unlimited users. And then with that, we also offer unlimited technical support and free training. Practice Fusion practices seem like you're running at full capacity. So what we do is we not only offer live web-based training that you can go ahead and schedule with someone from our customer experience team, but we've also put together some self-led materials. So if you wanted to watch the recording to kind of get a hang of it, practices oftentimes use that, just are off and running, even without speaking to us. But we do offer all of those things for you. I have a question about fax without blast. Yes, you can actually get started with faxing and add blast later. We do offer bundling promotions though, so if you were considering fax, I would encourage you to get started with both, and if it turns out you don't need the blast, you could always eliminate that later. Adding solutions at a later date though, you don't get the advantage of the bundle discount. And I think that's all I had for questions. Thank you so much for joining me today. If you needed additional information, if you wanted to speak with someone on our sales team, we're happy to get you started. show you around kind of step by step inside of the actual application, you just want to call our sales line or email sales@updox.com to get that going. Otherwise, you're welcome to visit updox.com. We have a big free trial button on almost all of our pages, and that's how you get actually started with the application. Don't forget, if you start before Monday, to use that promo code RESOLUTION, and we'll discount your base fee by 10% for 12 months. Thank you so much. Have a great afternoon.